In this video, we are going to be discussing trauma-informed care and looking at the different types of trauma. So what is trauma-informed care? Trauma-informed care is about understanding the impact of trauma on an individual and then using this information to guide all aspects of service delivery to make sure that we are enabling that individual to recover and avoid re-traumatization. There are multiple types of trauma. So these include acute trauma, chronic trauma, complex trauma, development trauma, secondary or vicarious trauma, and historical trauma. Acute trauma is when a single incident happens. So this can be something that's distressing or overwhelming to you. And again, an example of this would be something like an accident or maybe a serious incident. Chronic trauma is basically repeated incidents or prolonged exposure to highly stressful events. So, typically, in war zones, individuals do experience, people who have been in war zones will experience chronic trauma. Another example of this is, prolonged physical, emotional abuse. These are really, really good examples of what chronic trauma looks like. And so, if someone is in a long-term relationship whereby they're experiencing domestic violence, again, this is a really good example of what chronic trauma would be. Complex trauma is typically when you have exposure to multiple traumatic events. And typically they are going to be quite invasive in nature. So you will find these in situations such as, child abuse cases, child neglect cases, or even, family violence situations. Development trauma is when you have trauma at a really, really young age. So when you're a child, so it's early stage trauma, right? So with development trauma, you typically see this in, early stage abuse or neglect. And again, you even see it in cases where you have prolonged separation from a family member or, a caregiver. Secondary trauma or vicarious trauma is when an individual is indirectly exposed to traumatic events through close contact with somebody who's experienced trauma. Now, again, this can happen as a care assistant or as a therapist, or even, with a family member who's experienced trauma. Historical trauma is the combined emotional and psychological wounding, right? So across a lifespan or generation. So typically you'll see this in things like colonization, slavery, or even genocide. So I'm just going to give you some facts. Now, trauma is the leading cause of mental health issues. And studies have actually shown that if you have experienced trauma, you are significantly more likely to develop PTSD, anxiety, or even depression. So according to the National Association of People Being Abused in Childhood, trauma actually increases the rates of substance abuse and self-harm. Now, this is obviously because people are trying to cope with their lived experiences. Now, by the age of 18, 1 in 3 children in the UK are exposed to traumatic events. And an estimated 50 to 70% of people will experience trauma at some point in their life. Now, of those people, 20% will go on to experience PTSD. Now, this actually translates to 6.7 million people in the UK who will experience and develop PTSD or develop complex PTSD at some point in their lifetime. So now we know the facts and the figures. What are the key principles of trauma-informed care? So we have safety, which is around creating safe environments. We have trustworthy and transparency. So it's about providing communication that's transparent, that's honest, and where you can trust it. So then we have peer support, which is about incorporating the experience of others who have lived through trauma as well. So number 4, we have collaboration and mutuality. So it's about working with our service users and working with other agencies. So number 5 is about empowerment, voice, and choice. So it's about empowering that individual to have their own voice. And obviously as a care service, enabling them to have multiple choices available to them. So lastly, we have cultural, historical, and gender issues. So with this, we want to make sure that we are respecting individuals and respecting diversity. And at the same time, we are supporting them because we all come from different backgrounds and we all have different needs. Let's look at safety. What is safety exactly? It's actually around creating a safe environment for that individual. Now, we want the person to feel safe, right? Where they feel comfortable, where they can relax. And ultimately, it's about creating an environment that's free from triggers that can actually re-traumatize that person. Trustworthiness and transparency is about having clear communication between the service user and the service itself, so the staff. Now, every service has a limitation on what they can and can't do. Now, that can be dictated by regulations or capabilities of that particular service. So it's always around having that communication with that service user to make sure they are aware and you're being as transparent as possible. What you don't want to be doing is making a promise that you can't keep. Moving on to peer support. Now, peer support is a really, really good one. Now, what's better than an individual who has, gone through trauma and overcome trauma, right? So it's about having relatable experiences for that individual. And so they know that their feelings and what they're feeling emotionally is completely normal. And it's probably one of the best things that you can do for your service users is give them a person or, introduce them to somebody who's gone through that lived experience. Collaboration and mutuality is about engaging with other parties and other agencies to further support your service users in regards to, better decision making and leading to better outcomes, more comprehensive care plans that actually understand and, refer to the particular need of that individual. So this could be collaboration with, doctors, nurses, therapists, it can be social workers. The ultimate goal is to extract their knowledge for the benefit of your service users. So empowerment, voice and choice is about enabling individuals to take control of their mental health. Now, it's about empowering individuals to engage in the active writing of their care plans. And again, we want to try and build confidence, right? And the best way to build confidence is allowing individuals to lead the way when it comes to their care and support. So lastly, we have historical, cultural and gender needs. Now, individuals experience trauma in different ways depending on, cultural norms, different cultures, as well as, different values as individuals. Now, on top of that, you will actually experience trauma in a different way if you're a male or female. It's about understanding it and relating to that particular individual to make sure that the care that we do give is in line and supportive with their background. There are 4 key elements to trauma-informed care. So you have realization, which is basically realizing the impact of trauma on an individual and their family, as well as their communities. So you have recognition, which is basically recognizing the signs and symptoms of trauma in that person. We have response, which is integrating trauma knowledge into your policies, your procedures, and your services practice. Lastly, we have resist re-traumatization, which is about creating practices which are going to prevent the re-traumatization of that individual. Thank you so much for watching this video. If you've enjoyed it, please like, subscribe and press the notification bell so you are notified anytime we make a new upload. Now, if you do have any topics, please drop it down in the comments below and I'll be sure to provide you a response.